Okay. And we, so let's look at the slides and we start with the current slide. And is it full screen?
No, ma'am.
So we do the same procedure one more time.
Yes, ma'am.
Yes,
Obviously.
ma'am.
Thank you. Well, now we're going to, let's say Yonika is joining us. We're going to read so the article about Nasreen Ahmed. So she's a doctor and she's speaking about herself and her medical practice. Let us start with Aman. Aman.
My name is Dr. Nazreen Ahmed, and I work as a pediatrician in the Central Auckland, New Zealand hospital. I have always enjoyed working with young children and their parents. One of the main factors that led me to the consider specializing in this field was my own experience of bringing up my two young children. The understanding this has given me has helped me to empathize more with the parents when they will become very anxious.
Mhm. So she speaks about her personal details, about her family. Mhm. And another part is for Apeksha.
Yes, ma'am. Bringing up my own children has made me actually aware of the parental fear of potential threats throughout childhood, from infant diseases, illnesses like infectious parasitis, varicella, morbilli, rubella, pertussis, acute laryngotracheobronchitis, rubella, meningitis, poliomyelitis, and tetanus. And then there is the parents' apprehension associated with vaccinations like MMR. If I were not a doctor myself, I would probably feel as concerned and fretful about my own children as many of the parents I see who want to discuss combined vaccinations for their children.
Mhm. You are very good at reading the names of the diseases. So especially this long one, which is acute. Will you repeat it, please?
Laryngotracheobronchitis.
Thank you. So it's impossible for me to pronounce. Okay, and so we can see that there is the abbreviation here in this part of the story. So MMR. So what does it stand for? Who knows about this? MMR. Yes. So these are the first letters of some just infant diseases.
Ma'am, this stands for measles, mumps, and
Measles,
rubella
mumps, and
vaccination.
Yes.
rubella.
Yes, ma'am.
Okay.
Mumps and rubella.
Yes, good.
It is written there above.
I
That is
mean, it's mostly given to the children.
Yes. So to the young children. Okay. And so let us just look at the sentences on this slide, and we need to change one of the words in each sentence to make it true. So, for example, the first, Misha, read it, please.
Yes, ma'am. Dr. Ahmed has never enjoyed working with the young children and their parents. The answer for this is Dr. Ahmed has always enjoyed working with the young children and their parents.
So instead of never, we need to use always. Okay. So, Nivas, please.
Yes, ma'am. Second sentence is Dr. Ahmed has no children of her own. The correct one is Dr. Ahmed has two children of her own.
Yes, two children. Well, please, Vandana.
Yes, ma'am. The experience of raising her own children means Dr. Ahmed is fairly conscious of the fears faced by parents throughout their children's childhood. Ma'am, it's true.
It's true, yes, you're right. Can we change, for example, the word fairly with a different one? So with a stronger, which has a stronger meaning. Instead of
Okay.
fairly, so, and she uses this phrase, she says,
Acutely.
yes,
Acutely aware.
acutely aware, yes. Acutely conscious of the fears. Okay, so Priyesh, please, the next sentence.
Ma'am, this sentence says that Dr. Ahmed feels that being a doctor possibly makes her less worried about vaccination for her own children. Ma'am, we'll remove possibly from here, and it will be Dr. Ahmed feels that being a doctor makes her less worried about vaccination for her own children.
Okay, or we can use instead of possibly a stronger word, which
Ma'am, we can just remove the possibly and it will be stronger. Ma'am, the
I
sentence will be
see, I
doctor
see.
makes her
Okay,
less worried.
so no questions.
Yes,
Okay.
ma'am.
Rakhav, please. Ujval.
Yes, ma'am. All of the parents Dr. Ahmed deals with are anxious about vaccinations. Ma'am, we can change all word with many.
Many. So not all of them, maybe some are not anxious, but many of the parents.
Ma'am,
Okay. Yes.
for the fourth question, Dr. Ahmed feels that being a doctor fretfully makes her less worried about the vaccination of her own children.
Okay, possible.
Yeah.
So actually, we can also use probably, yes.
Yes.
And
Unit 7.
just here we have the listening task. It is also about Dr. Ahmed. And so in this episode, she's talking about herself. If we have a look at the questions about their listening, so what will Dr. Ahmed be speaking about? What will we hear? What is it about? Can we guess? Just looking at the questions.
When we can
Ma'am,
see that
experience.
talking about herself, her weakness.
Mm-hmm.
It can be some kind of interview recording, or maybe because there's
Okay. Yes. So some weakness we see, her experience, maybe she's answering, she's taking part in an interview. Now, let us listen to this interview episode, and just then we'll answer the questions. And you'll tell me if you can hear.
Unit 7. Listening 1.
Can you hear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, now.
Unit 7. Listening 1.
This brings me to an aspect of the training and job application process in New Zealand, which I initially found alien to my cultural background. Talking about oneself, especially about strengths and weaknesses. A weakness I used to have was over-empathizing with the parents and becoming upset when something went wrong with one of the children. In the recent interview for my present post, I related a case where a child almost didn't recover from an attack of meningitis, and I became very upset, even in the presence of the mother. I mentioned how I recorded both the good and bad experiences as part of my daily reflection, and how I talked to colleagues afterwards and soon realized that they had faced the same problems. I now see recording and analyzing my weaknesses in a more positive light, as a means for self-education and advancement.
Do we need to listen for the second time?
Yes, ma'am, one more time.
Yes.
Yes, ma'am.
Unit 7. Listening 1.
This brings me to an aspect of the training and job application process in New Zealand, which I initially found alien to my cultural background. Talking about oneself, especially about strengths and weaknesses. A weakness I used to have was over-empathizing with the parents and becoming upset when something went wrong with one of the children. In the recent interview for my present post, I related a case where a child almost didn't recover from an attack of meningitis, and I became very upset, even in the presence of the mother. I mentioned how I recorded both the good and bad experiences as part of my daily reflection, and how I talked to colleagues afterwards and soon realized that they had faced the same problems. I now see recording and analyzing my weaknesses in a more positive light, as a means for self-education and advancement.
Okay, so let us listen to Sayunika. So for the
Yes,
first session.
ma'am. Why was it difficult for Dr. Ahmed to talk about herself? It was difficult because she was very emotional, and she feels a connection with the parents because she was also a parent. And
Okay.
she can
Yes.
feel
Yes, Priyash, please.
because of the cultural background she has.
Ma'am, actually, she was having a cultural background in which talking about oneself was giving her a feeling, a complexion of being alien to her cultural background. Ma'am. That's why she wasn't actually. It was difficult for her to talk about herself.
Yes, because of the cultural differences. Yeah. Okay, because she's now where? Which country does she work in?
New Zealand.
New Zealand.
New Zealand, and she's
New
not
Zealand.
native of New Zealand. She has come from another country. Okay, so Ritik, please, the next question.
Yes, ma'am. What does she describe as a weakness in herself? Ma'am, she described the main weakness that she is an over empathizing with the patients, and become upset when someone went wrong with the children's or the family members.
Yes,
And she
exactly.
this shows that she is very careful and sensitive toward the children and the parents that he works,
Okay.
and do the job is politely and full dedication.
Okay, good. Thank you. So Moht, please, the next question.
Yes, ma'am. Does she have the weakness now? Ma'am, no, ma'am. Now she don't have any weakness, because after the case of small children with which is not who are not recovered with the meningitis. So, ma'am, after that she recorded and analyzed her weakness, and now she is working on her weakness. And I don't think, ma'am, does she have any weakness now?
Yes, she has
Because she
overcome.
remove all the, yeah, ma'am, by recording and analyzing her weakness.
Has overcome her weakness now.
Yeah, ma'am.
So Aman, what about question 4?
What example does she use to explain the weakness? Describe how she uses the example of her own experience, as once she had a patient who was unable to recover, and she was talking about that, and describe how when she used the example. She was using this example to empathize herself, and this was her weakness. Yes, ma'am.
And she showed her weakness to in front of the just parent. Yes.
Yes, ma'am. She was talking to her parent.
Okay. Well, Apeksha, please. The
Yes,
next
ma'am.
question.
What does she now feel about recording and analyzing her weakness? Well, she now feels more positive. Well, she takes it in a more positive light, and as a way of self education and advancement.
For education and advancement. Okay, so this is the way we should deal with our strengths and weaknesses, and it's very important to a doctor just to understand the weak points, just to be able to do something and just to educate and just improve the practice. And if we have a look at, yes, this slide, this is about the case, I mean, with Dr. Ahmed. She recorded both the good and bad experiences as part of her daily reflection. What do you understand by reflection here? What does it mean, reflection?
Learning, ma'am. When like
And to
I
analyze the
analyzing her
mistakes and
weakness.
improve
All
it.
Mhm.
Ma'am, all the
Ma'am,
reflections,
daily,
all the
ma'am,
good
daily
things and the
reflection
bad
is
things.
mostly.
Analyzing, learning, just
Ma'am,
and making
self-reliant and all, ma'am. She's actually self-examining herself. That is the daily reflection.
and making some important conclusion
Positive.
from so her mistakes. Mhm.
Yeah, ma'am.
Have you ever been asked to keep a record of your learning experiences?
Yes, ma'am.
So when was it and why?
Ma'am, we had a subject in our schools, ma'am, QCT quality circle time, and there we were actually told about the behavioral skills and how we should interact, how we should maintain a harmony and all. So there, ma'am, we had a log file. I mean, we had a book. It was known as our reading log, and we used to maintain it with our experiences, that what good we did, what wrong we did. Also, there was a confidence diary where we used to write these things, ma'am. So this was a time when I was actually asked to keep a record of my own learning experience from day-to-day life.
And was it useful?
Ma'am, it was very useful. It is useful, ma'am. It really works, ma'am. When you actually look at how you acted on a particular thing, how the things would have been if you acted differently, if you analyze, ma'am, it actually helps a lot in self-growth, ma'am.
Okay, so
sometimes as if now also.
Thank you. Can anyone else speak about your experience with the recording of?
Ma'am, we had a log file kind of thing during school days. We were asked to keep the record of our marks and even the answer papers, like to analyze what mistakes we are making, where we are doing those mistakes and why we are doing those mistakes. So analyzing it point to point and then improving it in the next exam. That was kind of reflection we had.
So this is in terms of education, learning
Education,
process.
and it can be applied in other aspects of life too, like even in daily life. If we were told that before you go to bed, just think about your daily routine, what you did and what you did wrong, what you did right. Just think of it and then analyze what things you should have done instead of doing what you did.
Very
And even if we
interesting.
talk about our medical field itself, many students have a small diary. They jotted down that this should be done and this should be the experience. They take the experience from their seniors and they write it down. So when they themselves face it, that keywords are very useful.
So the question about whether it's acceptable. So I see that this is a very widely used in your culture, right? So you got used to this reflections and analyzing these things. I see. Well, and yes, this is like the example, just to talk about strengths and weaknesses, like you just note them down. Okay, now let us just focus on some words which will be used in the following just conversation about non-technical language. So the non-technical language which parents of children normally use when they speak about infant diseases. So, for example, come out in, become covered with a rash, for example, come out in rash. So German measles, German comes from German, in other words, closely related to. JAB stands for vaccination injection. Up means swollen. Scab to form a crust, like in the picture. So to form a crust, scab on a wound or sore. Runny nose, you know. And stridor, this is an inspiratory sound, sound which is due to partial obstruction of the upper airways. Stridor. So let us move here to the next slide, and here you can see some names of infant diseases that are used by common people, not by medical professionals, and we should just think of the medical equivalent to these non-technical terms. For example, the first is chickenpox. What's the medical term for chickenpox?
I'm varicella.
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 Yeah, ma'am.
So please, I would like you to write them down in your notebook. So you write them in pairs. The first is the common word, and then the second is a medical term. So please, 3 minutes to you. Well, let us check what we've written. We stopped with, okay. Let us listen to Ritik. So about the second line.
Yes, ma'am. German measles, which is also called as rubella,
Rubella.
in non-technical terms.
I see, okay. Mocht, please.
Ma'am, whooping cough, ma'am, the non-technical term is pertussis.
Pertussis, okay.
Yeah, ma'am, pertussis.
Aman, please, the next.
Yes, ma'am. Epidemic parotitis is used for the mumps.
Okay. So infectious.
Ma'am, infectious parotitis is also used.
Parotitis, okay. Yes, Diaksha, please.
Measles is rubella.
Okay.
Rubiola.
Rubiola. Yes.
Rubiola, not rubella.
Or morbili. Morbili. So the next is for Misha.
Yes, ma'am. Croup is also known as laryngotracheobronchitis.
Yes, it should be acute. Yes, because we have 2 gaps here. And the last one is for Nivas.
Yes, ma'am. The non-technical term for lockjaw is tetanus.
Tetanus. Good. So now, when we've just revised these medical and non-medical words, let us use them in the sentences on this slide. We should use the non-technical words just to, because when doctors talk to the parents, they should use non-technical words just to be sure that the parents understand them. So if we have a look at the first sentence, Vandana, will you read it?
Yes, ma'am. If he had epiglottis, he would have stridor all the time and not just when he's upset. So I think it's okay. Ma'am, we have to put the words.
So we should use non-technical words from this slide, which we have written. So
Oh, okay, ma'am. Ma'am, so I think it is epilepsy,
there is no epilepsy here.
Whooping cough.
So if
whooping
we
cough. Okay, whooping
yes,
cough,
it's
whooping cough.
Mhm.
Ma'am, I thought we
And
have to give
whooping cough
disease.
is a medical, and instead of whooping cough, we should use
Pertussis.
what is the synonym to whooping cough?
Ma'am, medical term of whooping cough?
It's not whooping cough. It's the long word laryngo.
Laryngotracheobronchitis.
And instead of laryngo,
Crowd.
bronchitis. We should use croup. Yes, we should use croup. Okay. So please look at the other sentences and do it individually. Analyze the situation and think of the non-technical words here from this list. Which of them can be used to describe each situation, please? Now 3 minutes. So let us check Priyesh, the second sentence. Hello, Priyesh. Is Priyesh here?
Ma'am, yes, ma'am.
Please.
The second one is the gland behind his ears are up, but there are usually no complications with. Ma'am, this is mump, ma'am, infectious parasitis.
Yes, mumps. Rakhov, Rakav, Ujjwal.
Yes, ma'am. If you have just been vaccinated for German measles, you will need to avoid getting pregnant for the next 6 months.
Yes, because it's dangerous. Good. So, Sayonika.
If he had dash, he would have several symptoms like fever, conjunctivitis, cough, and runny nose. I think it's just a viral rash he got. It's epidemic paratiotis. The mumps.
Mumps was in number 2. It should be different.
The
Ma'am, hay
measles.
fever.
Measles.
Hay fever, ma'am.
Measles.
Hay
Rubella.
fever.
Rubiola, measles. Okay, so Ritik, please.
Yes, ma'am. If he had all his jobs, then he is well protected against tetanus, because the tetanus has lockjaw, and he has all his job, even if the broke the skin with a dirty needle, and it can also be caused by the infectious needle, tetanus.
So I didn't get it to what is the disease?
Tetanus.
Tetanus, and this is the medical term. What is the common word for
Lockjaw.
tetanus?
Lockjaw.
Yes, this is lockjaw. Okay, good. And Moht, the next sentence, please.
Yes, ma'am. I think he got dash doctor. He had fever and then. Yes, ma'am. I think he had a chicken pox. Doctor, he had a fever and then he came out in spots on his body and clumps, and then they started to scrape over. Ma'am, chicken pox.
Yes, chicken pox.
Because ma'am, spots appeared in chicken pox.
Okay. And now, Aman, the last sentence is for you.
Yes, ma'am. Whooping cough.
So we'll read the sentence.
If he had whooping cough, wouldn't he have a strong breathing in and out coughing?
Okay, good. So we should remember about just using common words for medical terms, just to be easy to be understandable for the parents. Okay, and I would like you to have a look at the sentences here, and you see that we were speaking about this, that children, babies cannot explain what's wrong with them because they do not speak, and sometimes we need to listen to their parents, their mothers, just to they describe their behavior of their baby, and we should be able to diagnose the disease judging by their behavior. So, and let us just think of the symptoms that the mother describes, like headache, photophobia, seizures. So look at the signs and symptoms. And now if we move to the description of the baby's behavior. So the first one, he keeps touching his head. What's the symptom?
Headache.
Headache.
Yeah.
He's been shying away from bright lights.
Ma'am,
Photophobia.
Yeah, yes,
Ma'am,
and
photophobia,
photophobia.
focal neurology.
What kind of disease is photophobia? No,
Focal neurology, ma'am.
Yes, okay. Then he can't move his head very much.
Neck stiffness.
Ma'am, neck stiffness.
He's not,
stiffness.
yes, he's not himself at all. I've never seen him like this before.
Unwell.
Yes, some abnormal behavior, so also connected with the being ill. He's been running a high temperature.
Fever.
Fever, right?
Photophobia. Oh, sorry, fever.
Also, he's come out in a rash around his middle.
Allergy.
Allergy, possible.
Rash,
Yes.
rash.
Yes. He's been making odd crying noises.
Focal neurology.
Yes, so
Yes.
any kind of unwell, yes, being unwell. And he's been making these odd movements.
Seizures,
Seizure.
epilepsy.
Yes, okay. Now, yes, we have a couple of minutes left. Now let us focus on the home assignment. We were speaking a lot about strengths and weaknesses. Now so you should write about your own strengths and weaknesses, starting with I feel that I am, and you should add examples. You should write about this, then you should memorize what you have written, and you should make a video record of your story. You should look at the camera and so speak about your strengths and weaknesses. It should be not very long, like 2-3 minutes long, and you should upload the video to your own YouTube channel. I know that your group has your group YouTube channel, so try to make up your own YouTube channel, and then so you should give the link to the Moodle site. There is the task on the Moodle site this week, and you should upload the link to the YouTube channel. If you have any problems with making up your own YouTube channel, I think who has got your own channel?
Me.
Yes, ma'am. I
I have got.
No problem with this, yes? So you may have the other students in your group just to start this channel. So I don't think it
Ma'am,
will be a
Ramdas is
problem.
having 5 million
पागल हो क्या?
subscribers.
इतने नहीं है भाई.
Sorry?
Sorry,
Ma'am,
doctor.
Ram is having a YouTube channel having 5 million subscribers approximately.
Who has got 5 million?
Ma'am, Ram Nivas, ma'am.